So hello guys, we are having right now questions of ENT recall which were asked in the recent exam which happened on 20th January 2024. So purely these questions are based on whatever feedback you have given us, my dear friends. Number one question, what can I see here is all about the audiogram of a 30-year-old female. First keyword is female. So again, we are having a dip at 2000 hertz, my dear friends. If a dip is there on 2000 hertz, this is called as what's your Carhart's notch. Carhart's notch is associated with what? What answer is coming in your head right now, sir? Otosclerosis. Let's read the explanation part also right there. Otosclerosis is an abnormal bone growth in the middle ear that can cause hearing loss. First of all, yes, there will be abnormal bone growth in the middle ear. First feature, it often affects the stapes bone. There is a fixation. There would be a fixation of foot plate of stapes. Okay, otosclerosis interfering with its ability to transmit sound vibrations. If stapes is fixed, then sound vibration would not be going in the middle ear to the inner ear from the middle ear, my friends. Another is treatment option include the hearing aid surgery such as tapedotomy. What are the other features you can think in the otosclerosis? First of all, female, and that too pregnant female. Pregnancy aggravates this condition. So pregnancy is something which is aggravating feature right now, sir. Here, okay. Patient hears loud sound more. Patient hear better in the louder sound. Okay, where there is a noisy area, and this is called as paracosis vilsi. Paracosis vilsi, where the patient is going to hear more louder, better in the noisy areas. Answer. So this is all about the otosclerosis. Which type of curve you are going to see? AS type of graph you are going to see here, and answer is right there. So now coming to the next question. A 50 years old male present with vertigo, tinnitus, hearing loss. Yes, vertigo is there, tinnitus, hearing loss is there. Audiogram shown below is what is your type? First of all, what type of audiogram is this? You can see the type of audiogram is rising audiogram, and rising audiogram is something we have learned in the Menieres disease. Menieres is also called as glaucoma of the ear, my dear friends. Let's see the explanation part here. Answer is Meniere's disease. A graph illustrates the Meniere's disease related to the hearing loss might show a fluctuating pattern over a time. There might be a fluctuation. The x-axis could represent the time and y-axis could represent the level of hearing loss. X-axis and y-axis. X would be representing the time and y will be representing the level of hearing loss. Peaks and chalks on the graph would indicate the period of worsening and improvement in the hearing, reflecting the episode natures of the Meniere's disease. So rising audiogram, rising what we have learned. Fluctuation is often accompanied by the other symptoms like the vertigo and there will be a hearing loss. Since this is a disease of inner ear, there will be a sensory neural hearing loss. Which type of low frequency or high frequency? There will be a low frequency sensory hearing. Unilateral or bilateral? Guys, remember it is unilateral sensory neural hearing loss. You have to remember right now here. So, chalo. Let's talk about the next disease. Question number 3 right here in front of us. A patient present with foul smell from the nose and the nasal obstruction is a foul smell. Patient present with foul smell. Patient आ रहा डॉक्टर साहब के पास and डॉक्टर साहब is getting the foul smell right here, sir. ठीक है. Image shown is roomy nasal cavities. Roomy nasal cavity filled with crust. You can see roomy nasal cavity filled with crust. And the same, your answer would be coming atrophic rhinitis. Let's read the explanation part right here, which is written right here. So atrophic rhinitis is condition characterized by progressive inflammation and wasting away. That is atrophy. Okay? Decrease in cell size and number is called as atrophy. Other than that, there is of a mucous membrane lining the nasal passages. Nasal passages के ऊपर सारे This can lead to the variety of symptoms, including the nasal congestion, foul smelling, discharge, nosebleed, persistent feeling of dryness in the nose. The condition can be primary, idiopathic, or secondary to the factors such as chronic infection, nasal surgeries, environment, etc. Now, the typical feature what we have in the trophic rhinitis, you all know, is merciful anosmia. That means patient is having anosmia and doctor साहब is having foul smell from the patient. डॉक्टर साहब को बदबू आ रही है बट पेशेंट मजे से बैठा हुआ है. जब नाक खोला है, whenever we are seeing the nasal cavity, you will see roomy nasal cavity, filled with crust, my dear friends. ठीक है. Medical management में how you will manage such condition. Medical management, if you talk about alkaline nasal dosing, sodium biborate, sodium chloride. ठीक है. These are the things we give. If medical management fails, we will go for the surgical management. And what we'll do in the surgical management? Young's operation, modified Young's operation, and Latz Slanger operation. So these are the operation what we are going to do in the trophic rhinitis. This is all about the trophic rhinitis. Coming to the next is identify the given image. I can very well see the image is of a nasal polyp. Nasal polyp. And guys, nasal polyp can block the nasal cavity. And moment the nasal cavity is blocked, guys, remember this is called as rhinorrhea clausa. Rhinorrhea clausa. Close. Something is closed. So nose is closed, my dear friends. So remember there will be a change in voice. Like in cold patient you will see. What are the other causes you can suspect right here, sir? There can be nasal polyp. What is there given in the image? What was there given in your exam image? Plus deviated nasal septum can be the cause. Plus rhinitis, medicamentosa can be the cause. Plus adenoids, if they are hypertrophied, there can be the different causes for the rhinorrhea clausa. C for clausa, C for closing. Okay, that would lead to the change in voice. Simple answer. Now coming to the next question, guys. Remember, a 22-year-old male with a recurrent bleed. 22-year-old with a recurrent bleed, CECT के अंदर. What are the false except? First, let's diagnose. 22 साल का with recurrent bleed is there. Plus, you can see on CECT, there will be a anterior shifting of the orbital wall. Okay, and this is called as Hallman-Miller sign. And Hallman-Miller sign is seen in Angiofibroma. Angiofibroma is a highly vascular tumor. So angiofibroma is a highly vascular tumor. That is why biopsy is contraindicated. Why it is highly vascular? Because the vessels lose the contractility. Vessels, the smooth muscles, lose the contractility. They are not contracting. The bleeding would not stop. That is why mostly it will bleed. Then coming to which is our source of bleeding. Source of bleeding, your answer would be internal maxillary artery. So guys, remember what all are true except. So remember all are false except. एक बात, all are false except. सब गलत है एक को छोड़ के, एक बात सही होनी चाहिए. सर सबसे पहले आप देखो, पहला ऑप्शन गलत है बिल्कुल. ब्लीडिंग इन एडजेसेंट ये भी गलत है. ट्यूमर मास ब्लीडिंग गलत है. ठीक है. ट्यूमर वेसल लैक कॉन्ट्रैक्टिलिटी इज अ ट्रू आंसर राइट हियर सर. क्लियर हो गया फंडा. सो दिस इज हाउ ब्यूटीफुली वी हैव सॉल्व दिस क्वेश्चन. नाउ कमिंग टू द नेक्स्ट. A 50 years old male. Yes, sir. 50-year-old male with the right sided serous otitis media. Right sided, that means unilateral है, ठीक है. Probable diagnosis. Let's talk about the nasopharyngeal carcinoma right here, sir. Answer is given right here. So nasal pharyngeal carcinoma, guys, remember etiology. If we talk about etiology is Epstein-Barr virus. From where it came? It came from China. Nasopharyngeal can lead to eustachian tube dysfunction. That too unilateral. That is why unilateral conductive hearing loss is there. That is why what is there, sir? Unilateral conductive hearing loss is there. Plus causing fluid buildup in the middle ear, resulting in the serous otitis media. Another complication what can happen is serous otitis media. It is essential for the individual to consult with a headache professional for the throughout examination, imaging, and appropriate diagnostic procedure for the precise diagnosis. Let it be. So remember, nasopharyngeal carcinoma, the treatment of choice is what, sir? What is the treatment of choice for nasopharyngeal carcinoma? It is what, sir? Chemo radiation. Chemo radiation is it. Trotostide is there, NPC. Take it. Neuralgic pain, palatal palsy, conductive hearing loss. Which one is there? Unilateral is there. Treatment is also there. Chemo radiation is the answer. Now coming to the next. Sir, the image is given. The patient present with the repeated infection from the lesion shown in the image. The correct statement in this image. First of all, what it is? The diagnosis we have read, sir. Preauricular sinus. How it is developed? So there are the 6 hillocks of his. 6 hillock of his. If they are not fused properly, it will lead to preauricular sinus formation. Guys, this hillock of his is derived from where? This is what is asked in this question. So hillock of his is primarily derived from the mesoderm. Which arch? One is better answer than 2. If both are given, obviously both we have to take. So according to the answers given, options given in the question, your answer would be what, sir? Mesoderm, first and second arch. Clear, sir? Sure. Now, a teacher present with the given image, my dear friends. What is your diagnosis? Right there, teacher is there. Teacher, singer. टीचर सिंगर कहाँ सुने थे सर हमने? वोकल नोड्यूल्स के अंदर. What is the presentation? What is the location right here? We see location. If we talk about the location, you will see anterior 1/3 and posterior 2/3. So you will see anteriorly it is present at 1/3 position. What is the cause? Vocal abuse. Vocal abuse. And nodule is a bilateral condition. You can see bilateral it is present at the both sides. Bilateral condition, my dear friends. What is a management in such condition? If someone is asking about the management, nothing you have to do, just the voice rest. So this is for the teacher's nodules, my dear friends. ठीक है, singers, teacher or the screamer's nodule. Bilateral condition is there. Location is anterior 1/3, posteriorly 2/3. Mostly आगे की तरफ को होता है. Vocal abuse इसका कारण होता है चिल्लाने से. जैसे हम जगराते वगैरह में जाते हैं, बहुत ज्यादा चिल्लाते हैं. ट्रीटमेंट में क्या है? वॉइस रेस्ट. ठीक है, चलो ये भी क्लियर हो गया. Now coming to the next question. Next question is all about what, sir? A diabetic patient. Yes. Next question is question number 9. Guys, a diabetic patient with the ear pain with the HbA1c examination 10 more than 6.5 will make you a diagnosis of diabetes. ठीक है, present the excruciating ear pain is there. Diabetic pain, discharge is there. So this is a disease of external ear, and mostly we have learned with the name called as malignant otitis externa. ठीक है सर, malignant otitis externa. Other name of malignant otitis externa would be necrotizing otitis externa. Necrotizing otitis externa, my dear friends. Remember, the causative organism would be Pseudomonas. The causative organism would be what's here in the malignant otitis externa is pseudomonas. Pseudomonas, my dear friends. Let's read the information with whatever is given right here, sir. Diabetic connection is there. Yes, diabetic individual are at high risk increase of infection, and high HbA1c level suggest of poor glucose control, which is further compromise the immune system also. The severe ear pain discharge are indicated of more serious condition than the typical ear infection. Necrotitis otitis externa is severe, potentially life-threatening infection of the external ear canal, my dear friends. Okay? And that is how we have diagnosed the case. Now coming, what type of stridor is present in the croup? So croup disease is also called as acute laryngotracheobronchitis. On X-ray, steeple sign is there. It is caused by the causative etiology is parainfluenza virus. Parainfluenza virus. And guys, it is involving complete airway. Complete airway is involved. That is why type of stridor which is coming would be the biphasic stridor. Would be what, sir? Your biphasic. Barking dog-like cough is there. These all are the features of what's your acute laryngotracheobronchitis. Let's see the explanation part. Explanation part, if we see, my dear friends, remember, while inspiratory stridor is a characteristic feature of croup, yes, it is important to note that croup can sometimes present with both inspiratory and expiratory biphasic stridor, making it biphasic. Characteristic biphasic stridor, that means high pitch barking cough sound may occur during the inhalation and the exhalation, both is there. So this is how. Next question is identify the instrument. So this is very simple, tracheoesophageal prosthesis. This is also called as Bloom Singer's prosthesis. Bloom Singer prosthesis, best way to produce the stick. Question number 12. A patient after a road traffic accident present to the emergency with the respiratory distress. Best way to secure the airway. Emergency के अंदर sir. Road traffic accident के बाद आया patient. Let's see tracheostomy. The answer is given. Why tracheostomy? Let's see. Tracheostomy is generally not the first line intervention in the pre-hospital or emergency setting. It is considered as the long-term airway assist is needed, or if there is a difficulty in the endotracheal tube intuition. ठीक है, clear हो गया? Now, tracheostomy is given answer. ठीक है? Respiratory distress is there. If respiratory distress is there and there is a severe emergency, you are not able to do the intubation, then your answer would be best among all. The biggest answer is tracheostomy. Where it is done? Between second and third ring. Between second and third ring we do. Once the question was asked like this, if there is a cancer larynx, then where to do tracheostomy? That type of tracheostomy is done between first and second ring, and this is called as high tracheostomy. This is called as what's called high tracheostomy. Chalo, ye bhi clear ho gaya? Next question. A patient presented with a finding in the external auditory canal following trauma. Trauma is there, that means your tympanic membrane is gone. You can see the blood which is collected right here, sir. Now, what is the management? Okay, sir. If we see the answer given here is ear dry, why there is an ear dry answer? Keeping the ear dry is a reasonable initial step in the managing trauma to the external auditory canal. Moisture in the ear can potentially exacerbate the situation, okay, lead to infection or hinder the natural healing process. If the ear would be dry, then better the healing would be. Chalo, ye bhi ear. By keeping the ear dry, it helps create a conductive environment for healing and reducing the risk of complication. If the ear would be dry, the complication would be less. While addressing the source of bleeding is essential, maintaining a dry ear is a practical measure to support the overall management of treatment. So, among the given options, aspirate the clot. Later on, we can do. Identify the source of bleeding is only possible if the ear is dry. Consult ENT specialist for the further evaluation would be done after keeping the ear dry. Initially, you have to stop the blood, keep the ear dry. So, among the given options, so best would be answer would be also keeping the ear dry. Then other things you can do. Question number 14. the following X-ray, you can see it is done 30 degree पे किया गया है. The answer is Caldwell. Why Caldwell answer is given? Let's read the explanation. The Caldwell view is the radiology refers to a specific projection used for imaging the skull. It is an anterior posterior projection where X-ray beam is directed throughout the frontal bone of the skull. कहाँ से आया? Frontal bone of the skull से आया. The view provides the detailed look on the frontal and the ethmoid sinus. The view will tell you about the frontal and the ethmoid sinus. Particularly useful for assessing the fracture, abnormalities, pathologies in these areas. So if the image you are referring to shown detail is frontal and ethmoid sinus, option B Caldwell would be the better answer. Okay, sir. So this is what the recall questions we have got from the ENT. Thank you so much, guys.